please be seated? Welcome and good afternoon. I'd like to start by thanking you for joining us this afternoon for this celebration of our class of 2026. Woo! We're here to celebrate our almost 100% respiratory therapist. Well, our students have put in a lot of work and effort, and in some cases, some tears. It would not be without your support that they would be here. That's in family and friends, clinical instructors, directors, laboratory instructors, and a variety of respiratory therapists along the way, right, guys? Yeah. So we'd like to thank you first. Hold on one second. This is a time of celebration, a chance to pause for a moment, reflect on all the things you've learned and some of the things they keep forgetting. That was supposed to be a laugh. It's a moment on your journey. Reflect about what you've just done. Take pride in it, because I know we're proud of you, all of us, your family, your friends, your new respiratory community, our administration, UCNJ. We're all so very proud of you. You guys have done amazing things. And you're going to do more amazing things, right, guys? Yes. I'm speechless, and you guys know how rare that is, right? They've worked so hard, and they've accomplished so much. I'd like to just get started with their celebration, if you all don't mind. I'll start by introducing our Vice President of Academic Affairs, Sarah Lacanino.
Hey. Graduates, I want to extend my sincere congratulations to each of you. You've embarked on a challenging and rewarding journey, and today marks a celebratory milestone in your lives. The path you've chosen, the vital profession of respiratory therapy, is one of immense impact. Respiratory care practitioners are an essential part of the healthcare system, providing specialized care and support for patients and making a profound difference in the lives of countless individuals. You embody qualities of compassion, resilience, precision, integrity, and dedication. I've personally witnessed the profound impact of respiratory therapists firsthand. Their expert care for my family member in the ICU during a difficult time was truly inspiring. Their compassion and expertise in ventilation, airway management, and oxygen therapy provided comfort and strength to our family. I am sure my experience is the experience of many others in this room. At one moment or another, we have all been on the receiving end or know of an individual who has benefited from the care of a healthcare provider. The direct interactions and care provided by these healthcare team members are often what patients and their families remember most. As you embark on this new chapter, know that the value and skills that define an exceptional respiratory therapist are the same value and skills that you learned in your program and demonstrated countless times during your clinical rotations. Remember to continue to uphold these values: compassion, treat every patient with dignity, respect, and empathy; integrity, uphold the highest ethical standards in your practice, always prioritizing the well-being of your patients; lifelong learning, continuously strive for professional growth, embracing new knowledge and skills, and adapting to the ever-evolving field of healthcare advocacy. Be the voice for your patients, ensuring they receive the best possible care and have access to the resources they need. Be a great listener. Be a leader in your practice. Be an invaluable member of the healthcare team. You are leaving your program well-equipped with a set of skills that will add to your toolbox and will guide your practice. Your dedication to excellence in respiratory care will not only impact the lives of your patients, but will also contribute to the advancement of this critical profession. Congratulations, and may your journey as a respiratory therapist be filled with purpose, fulfillment, and countless acts of compassion. Finally, I want to express my sincere gratitude to Dean Dunscombe and our dedicated Program Director and Academic Specialists, Ms. Schock, Ms. Blazon, and Mr. Docknell, our lab and clinical instructors and clinical affiliates for their commitment to preparing the next generation of skilled and compassionate respiratory therapists. Congratulations.
And now a few words from Dean Dunscombe.
Dr. Lacanino, Program Director, Schock, Respiratory Care Specialist, Blazon, and Docknell, family and friends, and most importantly, the class of 2026. It has once been stated that once you cross the finish line, your life changes forever. The finish line for the academic race that you started several months ago is in sight. The origins of pinning date back to the 1100s in the Crusades. In 1850, Florence Nightingale received the Royal Cross for her service during the Crimean War. Respiratory care pinning didn't really take flight until 150 years later, but nonetheless, the pinning does represent a significant event that marks your transition from students to valued members of the respiratory care profession. You are going to be the individuals that will be the breath of life to patients that are struggling to breathe. You have managed to balance a heavy academic load, clinical time, and family responsibilities, and you have every right to be proud of your accomplishments. I know the respiratory care faculty members and your family members are proud of the person that you have become. It's my hope that you will take the knowledge that you have learned and the skills that you have developed and use them in caring for your patients with compassion and empathy. I'd like to leave you with 5 things in conclusion. Number 1, enjoy today and celebrate your accomplishments. You are entitled to that. Number 2, remember that learning is forever. You're not done learning. Every day on the job, you're going to learn something new. Number 3, remember to be at your best when your patients are at their worst. Be the respiratory therapist that you would want to be if you were a patient. Number 4, patients may not remember your name, but they are going to remember what you have done for them. And finally, if you help one person to breathe and save a life, you're a hero. If you help hundreds of people to breathe and save their lives, you are a respiratory therapist. Congratulations.
Thank you, Dr. Lacanino and Dean Dunscombe. The next person on the agenda is our graduate speaker. She was chosen by the faculty. She exemplifies everything we want in our future. I'm going to say her name, but if she wants to make her way up, she can, but I'm going to keep talking about you just to embarrass you. So, Ms. Taylor Phillips has been such a wonderful person to have in class. She has a 4.0. She is the treasurer of our respiratory therapy club. She helped her fellow students with study sessions and study sheets and guides and anything else. Let me explain that to you, she'll always say. It's accurate. Yes. While working 2 jobs, if you can imagine that, and everything else, She's fabulous. So it's with great pleasure that Taylor is going to give us a few words of wisdom.
Thanks, guys. Okay. Distinguished faculty, proud families, but most importantly, the graduates of the class of 2026, congratulations, we did it. Think back to the first day of the program. Remember the overwhelming feeling of walking into the lab and staring at a ventilator? It was hard not to, ironically, hold our breaths while thinking, how will I ever learn what all these buttons do? We were intimidated by ABGs, terrified of intubations, and honestly, we were just trying to keep our heads above water in cardiopulmonary A&P. But look at us now. We went from students reading textbooks to the bedside as clinicians. We are the ones who walk into a room when someone is fighting for their next breath. And we are the ones who provide the calm, the skill, and the technology to offer that next breath. Our profession is unique. In a hospital setting, when someone is in distress, the first sound they often hear is the voice of a respiratory therapist. We are the architects of the airway. We are the quiet confidence in the middle of a code blue. And we are the ones who hold the hands of patients who cannot speak, yet we understand exactly what they need. There's a profound intimacy to our work. We deal with the most fundamental human function, breathing. And we've learned that breath is not just a biological process, it is life itself. It's the ability to laugh, to cry, to sing, and to say, I love you. And by protecting that function for our patients, we aren't just adjusting settings or administering medications. We are restoring the dignity of a person and buying time for the moments that matter most. The journey to this day has not been easy. We've sacrificed sleep, missed family gatherings, and studied till our eyes burned. We've seen things that changed us. Patients who made it home to their families and patients who didn't, that we carry in our hearts to this day. These experiences have forged us into professionals who are not only technically proficient, but we are deeply empathetic. So as we move forward, the technology in our field will change, new ventilators will come, new protocols will be written, and our roles will continue to evolve. But the core of what we do remains unchanged. No machine, no matter how advanced, can replicate the human connection of an RT who shows up, who listens, and acts with compassion. So as you step out into your careers, I challenge you to stay curious. Never lose the hunger for knowledge that brought you to this program. But most importantly, stay human. When the alarm bells are ringing and the shifts are long, remember behind every ventilator is a patient, a person. Be the advocate they need and the steady hand that they rely on. We're entering a field defined by the lives that we touch and the air that we help our patients breathe. It's a heavy responsibility, but it's one of the greatest privileges anyone could ever ask for. So remember Jody when you're looking for the why behind the what. Remember Agnes if you're ever struggling for the answer because you know what it is, because that is what it is. And lastly, remember Rob from the first day of our program. Show up and be the best. They say that the average person takes 20,000 breaths in a single day, but none of us have to worry because UCNJ Respiratory Care will be there. Thank you.
Thank you, Taylor. At this time, we're going to get to the fun. Could Ms. Blazon and Mr. Ducknell please come to the front? It's the three of us. Without them, we don't get it done. Okay, we go in the front a little bit. Good to have them behind. Just kidding, we're not. Okay. First, Daniel Dos Santos. Stand up. The other face that way. First one's always the hardest. Stephanie Estaverne. Elijah Gilead. She does that. Talesia Gilead. Go team. Jacqueline Goncalves. Clarence Griffin. Rhonda Hanin. Markinson Henry. Nikki Khan. Emily Montedesco. Emily was also our student advisory secretary. We'd just like to take a minute to recognize our student advisory board members for all their extra help. Thank you.
Thank you for your help.
You're welcome, honey. Fatima Nadim. While Fatima makes her way out. Sorry. Fatima was also the president of our student advisory club, and she and I worked very closely together. Dali Okoro Dokwa. Chiamaya Ogabana. Kahandi Oladija. Miss Taylor Phillips. There you go. Sorry. Mirdia Pierre. Wilkinson Patois. Jesus Segovia. Woo! Isaiah Shell. Isaiah was also the vice president of our student advisory club and super helpful in all sorts of things. Kevin Vargas. Josiah Winjobi. Now, we know they're all exceptional, but we also have an additional honor. There is a Respiratory Care Honor Society. It's called Lambda Beta, and it's the cream of the crop. And we are lucky enough to induct a few of our students. All the students, as I announce their names, are going to come up and receive a cord and a pin that they may wear at graduation. This is an additional achievement. And I'm pretty sure, I'm checking with my partner, every single one of them had a 4.0. Pretty awesome, right? Yeah. As I say your name, come on up. Kevin Vargas. Markinson Henry. Miss Nikki Khan. Chiamaya Ogawana. Miss Taylor Phillips. How you guys feeling? Yeah? Enjoy it. As our dean said, as Taylor said, as Dr. Lacanino said, celebrate this moment. Keep learning. That's easy, right, in respiratory? Yeah. This is only the first step, right? We're gonna go forth. But for right now, you may pause. Enjoy the view of all your loved ones and all of these people that support you. That's it. Smile at them. They're it. On behalf of UCNJ and the Respiratory Care Program, I commend you. And I'm going to miss every single one of you. Go out and do us proud. Both moms and dad. Okay? I think they did good, don't you think? Yeah. We will be having some cake and refreshments out in the center, in the student center, so please join us for pictures and to continue celebrating our graduates. Thank you, everyone, for attending. Supposed to go out orderly.